Right now, billions of dollars are flowing into communities across America to fight the opioid crisis. But here's the shocking part. Most people don't even know that it's happening. And the question is, can you actually use this money to save lives, or will it get lost in the system? The money is coming from what is called the Opioid Settlement Fund. This fund comes from lawsuits against opioid manufacturers, pharmacies, and distributors that have contributed to the opioid crisis. The basic idea is simple. The companies that profited from the opioid crisis should be the ones that fix it. And by law, the money must go towards addressing the opioid crisis and not just get lost in other areas of the budget. So how is the opioid settlement funds distributed? The local governments get to decide where the funding is used. They can spend it on treatment programs, recovery housing, addiction recovery, prevention efforts in schools, and expanding access to care to those communities hit hardest by opioids. This is a huge opportunity, but funding programs on paper is not the same as making them reachable in real life. Even if a county opens a new clinic or hires more staff, people still have to get there. And for many, transportation is the #1 barrier to getting help. So think about Paul. He lives in a rural community an hour away from the nearest treatment center. Or even Anne, who lives in the city but does not have access to transportation and needs daily medication. If they can't reach care, they can't use it. It's the biggest gap in the system. Now, can mobile healthcare solve this problem? A mobile unit is a clinic on wheels. It can be a van or a bus that travels directly to the underserved areas. Some units are set up for counseling and peer support, or others can provide medically assisted treatments, hand out Narcan, or connect individuals to resources that they need for healing. Some even offer basic primary health care. The point is very simple. Instead of waiting for people to come to treatment, let's take mobile care and go directly to them. For people like Paul and Anne in our examples, this can be absolutely life-changing. If their county invests in a mobile unit, they can spend a day visiting the community where Paul comes from that doesn't have access to a healthcare center. The next day, it can be parked in Anne's neighborhood where overdoses are high and services are limited. Suddenly, care is not far away. It's right there where people live. And here's the key part. Opioid settlement funds can be used to purchase mobile units to respond to these crises. That means that communities like yours don't have to choose between building a facility or serving a rural community. You get to do both. The opioid crisis has gone on far too long, and we have to seize this opportunity so that we can make care accessible. People are far more likely to start treatment if treatment comes to them. And once they start, the chance of them staying in recovery goes way up. As more communities like yours learn that the opioid settlement funds can be used for purchasing mobile clinics, you gain a powerful tool to fight the opioid crisis. At the end of the day, the money is there to help people, especially those that need it most. The question is, will you use it in ways that will actually reach them? When you're ready to start your mobile clinic, take a look at our 3-part series on how to start one. I've linked it up here. If you've got any questions, drop them below. We're always here to help.